Good morning. Myself, Dr. Manisha, Assistant Professor, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel, RPIIT Academics. If you like the content of this channel, please like, share, and subscribe. Today's my topic degenerative disorders. OA. It means osteoarthritis. OA is a degenerative joint disease, multifactorial and still not understood. Commonly, it is thought to be wear and tear of joints as one ages. OA are recognized primary and secondary. Primary OA. This occurs in a joint de novo. It occurs in old age, mainly in the weight-bearing joints, knee and hip in a generalized variety. The trapeziometacarpal joint of the thumb and the distal interphalangeal joint of the fingers are also affected. Primary OA is commoner than secondary OA. Now, the second one is secondary OA. In this type, there is an underlying primary disease of the joint which leads to degeneration of the joint. Often many years later, it may occur at any age. After adolescence and occurs commonly at the hip. Predisposing factors are congenital maldevelopment of a joint, irregularity of the joint surfaces from previous trauma. Causes of secondary OA of the hip. Idiopathic post-traumatic example fracture of femoral neck, alcoholism, postpartum failure, patient on steroids, patient on dialysis, sickle cell anemia, coxa vara, congenital dislocation of hip, old septic arthritis of the hip, malunited fractures, fracture of the acetabulum. Pathology. Osteoarthritis is a degenerative condition. First of all, affected the articular cartilage. Changes in the water content and depletion of the proteoglycans. Repeated weight bearing such cartilage leads to its fibrillation and cartilage gets ablated by grinding mechanism at work at the point of contact between the opposing articular surfaces. Eventually, underlying bone is exposed. With further rubbing, the subchondral bone becomes hard and glossy. Meanwhile, the bone at the margin of the joint hypertrophies to form a rim of projecting spurs known as osteophytes. A similar mechanism results in the formation of subchondral cyst, sclerosis, the loose flakes of cartilage inside synovial inflammation, and thickening of the capsule leading to deformity and stiffness of the joint. One compartment of a joint is affected more than the other. For example, in the knee joint, middle compartment is affected more than the lateral, leading a varus deformity, genu var.